So I'd like to introduce Mandy Davidson, who will be presenting today's webinar. Welcome, Mandy.
Hi, everybody, and thank you, Bhavani, for that introduction. As she says, my name's Mandy Davidson, and I work as part of the medical team at Scope. But I'm an optometrist and I have a special interest in dry eye. I still manage to practice part-time, and I run a specialised sort of dedicated dry eye clinic for a local optometrist. So I'm really happy to still be seeing patients as well. So talking about dry eye, I appreciate that I've probably got quite a varied audience here. So I'm going to try and pitch it at a level for everybody. So please forgive me if some parts seem a little bit basic, but please ask questions if there's anything that you don't understand. And either I can't see you all, so I won't see anybody's hand going up. So either pop it in the chat, or perhaps Bhavani can interrupt me or field some questions for you as we go along. But if I can leave you to manage that side of things, that would be great. So dry eye disease. I'm sure we're all familiar with the term dry eye, which is a really common cause for eye irritation and discomfort. For some of you, it will resonate more than others, depending on how and if it affects you. But I think it's fair to say that more of us than ever will probably have experienced some form of dry eye related symptoms, especially during the pandemic, when our lifestyles changed quite considerably and we were doing very different visual tasks to what we'd done before. So dry eye disease, what is it? It affects thousands of people in the UK. For some, it's little more or no more than a mild inconvenience, whilst for others, it has a significant impact on their quality of life. But regardless of the severity of your symptoms, you're probably familiar with the terms gritty or burny, stingy, sore, tired eyes. Some of you may even experience watery eyes, which I'll explain a little bit later. So dry eyes have less moisture on the surface of the eye, either because the eye's not producing enough tears, or because the tears that you have aren't a good enough quality and so evaporate too quickly into the air. But until we're affected and experience the symptoms, none of us really think too much about our tears. But I'd like to just share with you a few interesting features about this really incredible liquid. So the tear film is actually like no other fluid in the body, and it covers the surface of our eyes at any given time. But it faces two main challenges, but all of its components are cleverly designed to overcome them. So let's take a closer look. So what makes up our tears? Now, the image on the screen is of a blown up tear film, but I'm going to talk you through it, and we're going to simplify the tears and the structure into three layers. Now, there's a sticky layer, a mucin layer, which is the innermost layer of the tears, and it's closest to the surface of our eyes. And this is produced by cells all over the surface of our eye. Then we have the middle layer, the aqueous layer, and this is the watery layer, and it's kind of the big, thick filling in the sandwich, if you like. It's the thickest layer of the tears, and it's produced mainly from the lacrimal glands. And then we have the oily top layer, which is the thinnest and most delicate and possibly the most important layer. Now, these oils come from tiny little glands situated in our eyelids just behind our eyelashes, and these oils secrete every time we blink. So blinking is really important, and every time we blink, these oils are spread across the surface of our eyes onto our tears. And these oils form a protective layer which prevents the underlying watery layer from evaporating. Now, this all sounds very clever, but the ratio of these components is really important to produce a well-functioning and stable tear film. So in order not only to perform its role in lubricating the surface of our eyes, but it will also flush away particles of dust and debris. But blinking doesn't only spread the oils, it plays an important role in tear production as well. So if you don't blink enough, for example, when you're looking at a screen, your tears will evaporate and lose their ability to moisturize your eyes. A lack of blinking can also cause the oils to stagnate within those little glands and cause them to become clogged or even blocked, and this in itself can lead to dry eye. So what are the functions of the tear film? Well, they'll provide lubrication during blinking. They'll help to provide oxygen to the cornea. They'll flush away debris and contaminants and metabolic waste from the eye. And it helps to prevent infection. So it contains electrolytes and proteins and antibodies that all aid our immune protection. But it's also really important to remember it's the first refracting surface of the eye. So a smooth surface is really important for stable, clear vision. And refracting literally just means bending the light in order to focus it. So it forms part of our vision process as well. Now, this all sounds pretty incredible, doesn't it? Now consider that the thickness of this tear film is less than 1/10 of the thickness of a human hair. I think that's an awful lot of responsibility for such a delicate structure. So what are the challenges that the tear film faces? You know, because our eyes are open to the air most of the time, there is this constant evaporation, which needs to be met by constant tear production. And so long periods of gaze, such as driving or looking at a screen, whether it's a computer or a television screen, the tear secretions can't always catch up with the tear evaporation rate. And this is often worse in patients with dry eye. And this is why blinking is so important, to constantly replenish those tears and spread them evenly over the surface of our eyes. So what happens during dry eye? Well, it's the reduced blink rate from these long periods of gaze that allows them to evaporate more quickly, and that will then give us the symptoms of dry eye. Now, if our eyelids fail to meet during a blink as well, if they don't collide, then there'll be insufficient oil to drag over the surface of the eye and form that nice protective layer and stop them evaporating. And once the front of the eye becomes exposed to the air, we get those familiar symptoms of dry eye. So this brings me back round to the beginning with the increased use of screens during the lockdowns actually has probably generated a significant increase in dry eye across all ages. Also think back to when we were wearing masks. Did you feel that your eyes got particularly dry after you've been sat behind your mask for a long period of time? Now, I still wear a mask in my clinics, and I know at the end of the day, my eyes feel perhaps more dry than they would do ordinarily. And that's because you get this warm curtain of air being directed upwards across your eyes through the top of the mask. And those of you that wear spectacles will probably notice that your glasses steam up. It has exactly the same effect. And this increases the evaporation rate, and that ocular surface, that surface of the eye, becomes dry and sore. Equally, the ocular surface of the eye becomes exposed if you can't produce enough tears in the first place. And remember that dry eyes often make it harder to perform daily activities such as looking at a computer or reading a book or watching television. It just adds to the challenge that we face. And I don't think that actually there is a typical dry eye patient any longer. You know, we used to just assume it as an aging problem. It can actually affect people of any age. It is more prevalent in the elderly and women. But don't underestimate the prevalence across the generations. It can actually happen or occur in any ages. It's reported that perhaps between 15 and 30% of people aged over 35 will have dry eye. But with the increased use of screen and the reduced blinking, we're actually seeing more and more young people presenting with dry eye. Oops, if it will click on. The excess screen use, the lack of blinking drives dry eye. And I've already talked about those masks causing more dry eye as well. So let's just think about some facts and figures here. More than 1 in 5 of us suffer from dry eye. That's about 12.5 million people. And put that into context, about 1 in 12 adults have asthma, which is about 4.3 million people. And we often hear people talking about asthma, but actually dry eye is much more prevalent. Around 65% of GPs feel that the incidence of dry eye has increased in the past decade. And 92% of clinicians suspect that screens and modern technology has contributed to this. I've said earlier, it's no longer exclusive to the elderly. So 76% of clinicians actually have reported an increase in symptoms in younger patients aged 18 to 34 compared to that 10 years ago. And remember, dry eye can occur in children. We're seeing it more and more in the younger generation. And remember, mask-associated dry eye is a real thing. And in its early stages, dry eye can cause just mild discomfort, but it can get very, very uncomfortable as the condition progresses. We shouldn't underestimate the effects or the impact of dry eye disease. It's not an insignificant condition, and it has a noticeable effect on quality of life. It's a real issue for those who suffer. Strangely enough, though, more than 3 in 10 patients, that's 30% of patients, actually put up with symptoms for more than 6 months before seeking their GP. Around 40% of patients says it affects their work. They need to take frequent breaks from their screen. And chronic dry eye results in a significant drop in the quality of life. And it's been put on a par with those patients who suffer from angina. So, you know, it does range. There's a huge range from mild to severe. But if you're unfortunate enough to have severe dry eye, it really can be quite debilitating.
Has joined the meeting alert.
And that's not all. You know, navigating stairs, looking at road signs, reading, cooking, recognizing faces, watching television, all these have challenges that are increased if you're symptomatic with dry eye. And even with mild vision loss, and I know that a lot of you have a struggle with your vision, but in a normally sighted person, the effects of dry eye can actually cause a vision loss and increase the risk of falling, increase the risk of depression, and actually have an impact on the risk of hip fracture. So it is a problem, and it is a problem that if it's caught early and if it's diagnosed early, you're much more successful at managing it. So what causes dry eye? What are the risk factors? Well, that's the complicated thing with dry eye. There are lots of factors that can contribute to it. Dry eye can arise from external influences such as your environment or your lifestyle, or from changes in the body's nervous or hormonal system. So environmental factors such as windy conditions, central heating, air conditioning offices or cars can dry out your tear film. Whilst these environmental factors might not be the root cause of your dry eye, they can certainly worsen your symptoms. Everyday activities such as driving, reading, looking at a computer, watching television can worsen symptoms, as can wearing contact lenses or a poor diet. Certain eye operations can cause dry eye. For example, cataract surgery can sometimes lead to a temporary worsening of symptoms because the corneal nerves that help control our tears take time to recover from surgery. And sometimes the preservatives in the eye drops needed for recovery from these operations can actually affect the tears too. And then looking on at the physical changes, dry eye is part of our aging process. Tear production tends to reduce as we age. Hormonal changes in women are a factor, and these affect both tear production and the quality of the oily layer. Blepharitis and meibomian gland dysfunction, and I'll come on to these in a bit, can also lead to dry eye, as can some medications such as antihistamines, antidepressants, diuretics, all affect tear production in the body and can cause dry eye. And there are certain underlying systemic conditions as well that will have an effect, such as diabetes or Sjogren's syndrome, and the autoimmune conditions and rheumatoid arthritis can affect tear production. So let's take a closer look at the common symptoms and signs of dry eye. So if I start on my diagram here and explain, we're going sort of clockwise round from the top. Dandruff and flaky bits around the lash base of the eyelids, that's something called blepharitis, and that can lead to an inflammation, which in turn affects the quality of the tears. You can become light sensitive. You can struggle with your vision in certain lighting conditions, or you can be dazzled because the tear film provides an irregular surface on the front of the eye and so scatters the light. You can get fluctuations in your vision. You might find that you're constantly needed to blink in order to keep a vision in focus or in relative focus. And that's because that tear film needs to provide that smooth surface. And if it's not smooth, then it's going to cause problems with your vision. You can get gritty or burny sensation in your eyes, and they can become sore and red and inflamed, as can your eyelids. It can lead to contact lens discomfort, and it can also lead to eyelids that are difficult to open in the mornings because they tend to be stuck together because everything has dried overnight. But sometimes the difficult one to understand here is a watery eye. And many people ask me, how can a watery eye be dry? But it's actually a reflex watering. It's a reflex tearing because the tears themselves have evaporated too quickly. They've exposed the surface of the eye, and all the little nervous sensors in the surface of the eye have responded by saying, or sent messages to the brain that then come back to the lacrimal gland that the eye's dry. It needs to compensate for that. And in compensating for that, it overproduces tears. They're the wrong recipe of tears, and they spill out quickly onto your cheeks. So that's why if you ever go along complaining of a watery eye, or if you get a watery eye when you go out in the wind, that's a classic sign that your tear film's a little bit unstable and you may benefit from further investigations. So I did mention blepharitis earlier as well, and blepharitis is an inflammation of our eyelids. Blepha meaning eye, itis, inflammation, and it's Latin, and it is an umbrella term for an inflammation on our lids. And if you have dry eye, you may also have blepharitis. Blepharitis can cause little crusty, flaky debris around the bases of our lashes. And it's often difficult to see without a microscope, but it can cause our eyelids to become red and sore and our eyes to become scratchy. Sometimes the oil glands can get inflamed too, and even blocked, and this is called meibomian gland dysfunction, or you might hear MGD. Now, blepharitis is one of the most common reasons to cancel planned eye surgery, because this build-up of the crusting and the flakiness is an infection risk if you've got an open wound. So quite often, if you've got blepharitis, your consultant will send you away to try and manage it and reduce it before they list you for cataract surgery. So that was sort of a very quick overview as to dry eye and how it presents and how you might sort of resonate with any of those symptoms. But how can I, as an optometrist, tell if somebody has dry eye? And I'm very lucky because I have a special microscope that allows me to see a magnified view of the surface of the eye. And it enables me to look very carefully at the tear film. Now, it's not the best image. Some of you may be able to see this. If you look very carefully, if it will go on my screen. But you can see the eye blinking, and you might just see flickers of something moving up and down in the tear film there. So I can actually assess what the tear film's doing. And this isn't visible under a naked eye. It's not something a GP will have access to. So your optometrist or a consultant ophthalmologist is probably the best person to actually do an in-depth assessment on the surface of your eye and the tears. So what can we do to manage dry eye? How can we deal with it if we've been diagnosed it? Well, before I talk about management, I just want to introduce you to DEWS 2. And this is a document that we refer to an awful lot for evidence-based information. It provides information based on clear recommendations. And the DEWS 2 Dry Eye Workshop report took 2 years to compile. It involved over 150 clinical and research specialists from 23 countries around the world, and it divided it up into 12 subcommittees. It's quite a hefty document with 649 pages, so it's not your best bedtime reading, but it's a really useful resource. So anything from management, diagnosing, it gives us guidance and a unified guidance onto the condition. You'll be pleased to know there is also an executive summary, which is only 11 pages. So I encourage optometrists to at least dive into that one if they need any information on dry eye. So management, what can we do to help manage dry eye? Well, because dry eye is a chronic condition, I talk to my patients about a long-term management plan. There isn't a quick fix. It isn't really a treatment because there's not an end. It is about a management. It's an itis. It's blepharitis, inflammation, and you'll go through peaks and troughs. You'll have good days and sometimes have bad days. But you need to come up with a management plan ongoing. The simplest and probably quickest way to alleviate your symptoms of burning and grittiness is to use a lubricating drop, because that instantly adds volume to the tears. It moisturises the front of the eye and it takes that gritty, scratchy feeling away. However, in many cases, it won't address the true cause of the symptoms. We know that about 80% of patients who have dry eye also have blepharitis, and whether that's the flakiness on the lids or it's a blocked oil gland, it means that the management will also require a lid hygiene regime in order to reduce the eyelid inflammation and the irritation, as well as the eye drops. And it's for this reason that a management regime is probably the best way to manage dry eye and the associated symptoms. And Jews tends to agree with that. So the drops is just offering us instant relief, symptomatic relief. But a regime with lid hygiene is probably going to start helping to address the cause of the problem in the first place. Okay, so there's those crusty lids. And you may need to use several different therapies here. So let's look at this regime that you might be advised to use. So you might be recommended to use a warming mask. And these are masks that you can pop in the microwave for 15 seconds or so. They warm up and you pop them on your eyes for 10 minutes. And these reach a special temperature and they heat the oil in the glands, so that the oils can spread more easily over the tear film and help to make that tear film a little bit more robust. You might be asked to cleanse using a specially formulated wipe or a gel that will help reduce the build-up of the debris around the bases of your lashes. And then you've got lubricating eye drops, which will help to reduce the symptoms while you're trying to address the cause of the problem in the first place. And it's important that you do this every day. It's a bit like cleaning your teeth. It's getting into a routine of it. We take a lot of care on our teeth to prevent problems. We should be looking after our eyelids to make sure that we're producing the right amount of oils. We're not increasing any debris on there that cause any problem with our tear film production. And it's quite easy to remember. It's heat, cleanse, hydrate. It's a nice little regime to think about. So you're warming to get the oils flowing, you're cleansing to make sure those eyelids are nice and clean, and then you're hydrating to offer yourself some symptomatic relief. But what else can we do to help ourselves with dry eye? There's things we can do for ourselves in the home. So look at what we eat and drink. Staying hydrated is one of the best and easiest ways to keep our eyes moisturised. And try and drink that magic 2 litres of water every day. Don't down it all at once, but try and spread it out through the day so that the body can absorb it. The other thing you can do is try and include 2 portions of oily fish into your diet each week. Oily fish contains omega-3, which is an essential fatty acid, which has been shown to improve eye tears and reduce inflammation. There are vegetarian sources of omega-3 for those of you who don't eat fish, and these include nuts and seeds. But the omega-3 from fish, that's derived from fish, is much more readily processed by our bodies. You need to eat an awful lot more of the vegetarian source of omega-3 to get the same effect as eating your fish. Dry eye on screens. Remember to take a break. We blink less when we look at a screen. So look away from the screen. Remember the 20-20-20 rule. You may have come across that before. Look away from your screen every 20 minutes for at least 20 seconds at something about 20 feet away. And actually, you can bolster that by blinking 20 times when you're looking in the distance to spread that tear film a little bit more. Some people find it useful to have a sticker on their screen to remind them to blink, or set a timer to get up and move around, which is good for our posture every 20 minutes, and at the same time to do some blinking. And staying with blinking here, blinking is so important. It spreads our tears over the eye, and any incomplete blink will leave exposed areas, which will dry. So any concentrated task, not just screens, but reading, concentrating on anything, remember to blink. Sometimes we get so absorbed in what we're doing, we just stare and we forget to blink. And this tired feeling that we get in our eyes can sometimes be literally just because we're not spreading our tears effectively across the surface. If you're outside, you need to think about protecting your eyes. If you're out in the sun, it's important to wear glasses that are UV blocking. But if your eyes are affected and you want to protect them from the wind or the cold air, then wrap-around sunglasses or glasses with thick sides will help that air hitting the surface of the eye and causing that reflex tearing. And if your eyes are uncomfortable inside, you can consider using a humidifier, because dry eyes are much more comfortable in high humidity. And you can get little compact humidifiers that are available to sit on your desk or your tabletop. Some even have got a USB stick that you can plug into your computer. And when you're out and about, remember to direct any heat or cooling vents away from your face while you're in a car, or if you're out, you're sitting in an environment, if you're in a cafe or anything, don't sit directly under air conditioning, because that flow of air will dry your eyes out very, very quickly. And finally, remember to use your drops regularly. If you've been prescribed eye drops or recommended eye drops, don't just wait till your eyes are uncomfortable. You need to use them regularly to keep your eyes moisturised throughout the day and prevent them getting dry. It's a bit like putting on hand cream. You put on hand cream for dry skin and you need to regularly apply it. If you don't apply it, your skin cracks again. And dry eye is exactly the same. You need to keep it moisturised. So if you're recommended to use your drops 4 times a day, stick with it 4 times a day, even if you feel that they're getting better, because they're getting better or because you're keeping them lubricated. Dry eye is a chronic condition, sadly, and it does need ongoing management. As I said before, sadly, there isn't a quick fix. But if you build your regime of eye drops and lid hygiene into your everyday, you should be able to manage or at least control your symptoms. I never ever promise to my patients that I'm going to cure them, but I do hope that we will manage symptoms and we will reduce them considerably by working together. I can advise my patients on what they need to do, but at the end of the day, they have to weave that into their lifestyle sometime. And the other important thing to remember is that if you think you might have dry eye, or if you think they're getting worse, or you're not sure about what you're doing, go and see your optometrist for advice. They can have a look at your eyes on that special microscope, and they can give you advice as to what management that might be more appropriate to you. So that's it. I hope you found that useful. I hope you found it a little bit of an insight into dry eye, what causes it, and what you might be able to do to help yourselves. And I'm more than happy now to answer any of your questions. And I'd probably like to unshare my screen while I do that, because I'll be able to see you if that's all right.
Thank you so much, Mandy, for an excellent presentation on dry eyes.